Good evening, everyone.
Good evening, ma'am.
Am I
Good
am I
evening, ma'am.
audible?
Yes, ma'am.
Ma'am.
Can you see the slide?
Yes, ma'am.
Yes, ma'am.
Okay, then
Yes, yes.
we'll start with the class. Okay. Uh,
Um,
Please mute all your audio. Okay. So my topic is documentation and reporting. So client's record or the patient record is the most central information and communication tool for healthcare professional, and quality documentation and reporting is necessary for to enhance efficient and individualized uh, patient care.
मैम योर वॉइस इज स्मॉल मैम थोड़ा कम सुनाई दे रहा है
Voice is not clear.
क्लियर मैम बट स्मॉल मैम थोड़ा लाउड
Okay. Documentation. Documentation serves as a permanent record of client information and care. Reporting. Reporting takes place when two or more people share information about client care either face-to-face or by telephone. And according to Webster Dictionary, documents are defined as something written, furnishing evidence or information, and documentation as anything written or printed which is relied on as a record of proof for authorized person. Here, authorized person in hospital setting are those like the doctors, nurses, or those lab technician, etc. And report. Report is an oral, written, or computer-based communication intended to convey information to others. And reporting is the process of conveying the information to others. And the difference between record and report is that record is always a written one, whereas report can be either oral, written, or computer-based communication. Purpose of recording and reporting. The first one is communication. Um, Records serve as a vehicle for different healthcare professionals who interact with the patient to communicate among different professionals. For example, uh, record is required for communicating among nurses or maybe between nurses and doctors, nurses and dietitian, nurses and physiotherapists. And next is reimbursement. These days there are many like health insurance agencies. So like after getting the treatment, reimbursement means to get back the money that you have spent for the health. So you can reimburse this by providing certain document to those agencies. Research. For research, like the information uh, which is there in the record can be a good source of data for conducting various research. Legal documentation. These days, like people are very much aware of their health as well as the rights. So if any mistake occur, then they can even sue you. And if this thing reaches to court, then the document or the record can be shown as a evidence in the court. Auditing and monitoring. Auditing means review of the record. This is for the purpose of quality assurance only. And education, like from the document, many information about the patient is there regarding their clinical sign and symptoms, their treatment procedure, and certain medication which they are getting. So this can be used for education purposes for new nurses, doctors, or the student nurses, doctors. Communication within the healthcare team. So during the course of hospital stay, a patient may interact with 50 different professionals, including physicians, nurses, technicians, and others. Lack of communication creates situations where medical errors can occur. These errors have the potential to cause severe injury or unexpected patient death. And effective communication takes place along two approaches, and these approaches are recording and reporting. And all records contain the following information: patient identification and demographic data. Patient identification and demographic data includes like the patient name, age, sex, educational status, marital status, their hospital registration number, the admitting doctor's name, etc. And informed consent for treatment and procedures. So when a patient comes to the hospital, and if that patient is going to get admitted to that particular hospital, then informed consent must be obtained from the patient for treatment and procedures. Admission data. So admission data will be provided from the admission desk, and admission data includes like the patient name, age, sex, the admitting doctors, and the patient diagnosis. And nursing diagnosis